Good evening, ladies and gentlemen, and thank you for coming to this meeting. I've got an item which I have to read out first, just to make sure we're all safe and secure. So this is a meeting of the council held in public. It is not a public meeting. There is no fire drill planned, so if the fire alarm sounds, please leave by the exit nearest the large screen at the front of the room and proceed down the fire exit to the courtyard. Once it is safe to return, councillors will receive a text message. Officers will also advise when it is safe to return to the meeting. We are recording the meeting this evening using our webcasting system. The webcast will be transmitted live and will also be available on the council's website following the meeting. All mobile devices should be switched off or set to silent so that the meeting is not interrupted by ringtones. Generally, the public seating areas are not filmed. However, by entering the meeting room and using the public seating area, you are consenting to being filmed and to the possible use of those images and sound recordings for webcasting and or training purposes. Anyone attending to film or audio record any part of the meeting is asked to do so in a manner that does not disrupt the meeting. Please refrain from filming the public gallery. Thank you. Any apologies for absence?
I haven't received any. No.
Right, okay. Any declarations of interest? Right. Confirmation of the minutes of the last meeting. Is there any queries on it? Yeah.
Only to say, Chairman, that this is a scrutiny committee, and at the end of most of the reports it says the committee noted the update. It says that on the reports. It would be nice, and there's just one or two odd comments. It would be nice, particularly if there were a bit more points that were drawn out in. I mean, I'm not talking about the whole conversation, but some of the salient points that are raised. It would be nice to see that. So rather than, because we are a scrutiny committee, and that's what we're here for, to scrutinise the reports. Thank you.
Okay, thank you. That's noted.
Sorry, and declarations of interest. I was looking it up. I made a note. I need to make a declaration that I think it's on item 4. Sorry, tell a lie. Item 5. I was a director of the Basildon Community Transport Service 2016 to 17. I'm not anymore, but I thought I'd better declare it anyway.
Thank you for that, Councillor Schrader. Right. Okay, we've got some guests here this evening, and it would be nice if they could we could all introduce ourselves so that everybody knows who we are. Okay, so I'm Councillor Val Robbins, I'm chairman of this committee. So if we could start up the back with the chap in the red jumper.
I'm Clive Pole, I'm the chairman of the Board of Trustees for the Basildon Community Transport.
Okay.
I'm Tina Tickner, I'm the Chief Executive Officer for Basildon Community Transport.
I'm Kylie Ray Evans, I'm the Office Manager for Basildon Community Transport.
Shall we go to this table next? Yeah, so the NHS family here, Andrew Pike, Deputy Chief Executive at Mid and South Essex NHS Trust, on my right.
I'm Tayyib Haider, I'm the Medical Director at Basildon Hospital and currently the Interim Managing Director.
Hi there, I'm Simon Williams, I'm the Deputy Alliance Director for Basildon and Brentwood.
I didn't quite catch that.
Simon Williams, I'm the Deputy Alliance Director for Basildon and Brentwood. So I'm with the NHS, but I work more with our local GPs and community teams rather than the hospital.
Hi, I'm Stacey Clancy, Voluntary Sector Development Officer at Basildon Council.
Hi everyone, I'm Dave Toombs, I'm the Communities Manager at Basildon Council.
Hi, I'm Councillor McGeorge, I'm the Cabinet Member for Ageing Population and Health.
Good evening, everyone. Grant Taylor, Assistant Director for Community and Leisure here at the Council.
Good evening, everyone. Councillor Jack Ferguson, Cabinet Member for Culture, Sport, Children and Young People at Basildon Council.
Good evening, Cathy Kentish, Chief Executive for St Ives Braintree and South Essex.
Councillor Schrader, Billericay East.
Councillor Terry Sargent, Castleton and Crouch.
Councillor Ansell, one of the councillors in Friends Ward.
Thank you, everyone. Right, we're going to change an item and bring it forward. That's item 7, evaluating healthcare performance, so that our guests don't have to sit all the way through the rest of it. So if you'd like to take it away.
That's very much appreciated. Thank you, colleagues. So just for being, I'm Andrew Pike, Deputy Chief Executive at the Hospital Trust, and Tyab is our Medical Director at Basildon and currently acting as our Medical Director. We do have a slide, so we will just I'm just going to put up a couple of slides, councillors. I'm not a great believer in death by PowerPoint, but there might be just 1 or 2 reference points that would help committee members just frame any questions you wish to ask. So I'm relying on Tyab's technical skills just to get the screen up. Otherwise, I'll cope without it.
Waiting to be let in. Yeah.
And then share the
screen.
And
Go mute. Yeah.
Share there.
Yep, that's a share. Which content is that? Screen.
Share. There we go. Excellent. We've done it. So can you go on slideshow, Tyab, and then that'd be easier for everybody to see. Last technical task. That one. Ah, there we go. Excellent. Right, sorry about that. I put this slide up because I think it probably helps just frame our questioning. And I really want to use this to start from the top of the slide and go to the bottom. We're well aware MSE has been a trust very much in the spotlight, often for the wrong reasons, both through CQC inspections and performance. And those of you who are knowledgeable of this matter will know we stand as one of the bottom 10 hospitals in the new National League tables, both for performance and for elements of quality. And we have had 2 serious NHS CQC inspections, which have put upon us what's called Section 31, enforced actions to make sure that we improve the quality of our service. So the organisation has, since the autumn of last year, gone through a major process of change. And what you can see here as a slide is how we are focusing the organisation to address those issues. And that is leading to, first of all, a change in the leadership of the organisation, a change in how we're organising the organisation. That is now well underway. I'll just mention that in a second. And then importantly, those boxes in the bottom are the 6 priority areas for focus for both our current activity in this financial year and the plan for next year, and they directly relate to the concerns that have been identified both by the NHS leadership, our own local leadership, our own staff, our own local authority partners and community partners, and our regulators. So from the left-hand side, what we will aim to cover is where are we with our current improvements to emergency and urgent care. By that we mean what goes on in the A&E department, in the medical wards and the admission and discharge of our 3 hospitals, and clearly tonight we're talking about Basildon. Secondly, what we're doing to improve our cancer and elective waiting times. Again, I will update you specifically regards Basildon. What we're doing to improve our quality and safety and that's safety in our ED department, our emergency department, which was criticised by the CQC, and on our medical wards and in the leadership of our organisation. What we're doing about our safety, our leadership and culture, our financial delivery, which is one of the other reasons why we rank low in the NHS league tables because of our current financial performance. And then on a more positive note, what we're doing to implement the single patient electronic patient record and electronic patient system for our 3 hospitals, which will be a significant improvement to some of our antiquated IT infrastructure the hospital currently has. So in terms of our approach to the leadership, we have the clear strapline that we're one team working for excellent patient care. That is what everybody in the organisation is focused on. That's the 4,000 plus people in Basildon and the 16,000 people across the trust as a whole. We're very conscious of our public duties because we're spending £1.4 billion of public money, and we're treating well over 1 million patients every year across Essex. And obviously you can assume about 1/3 of that is servicing your residents in Basildon and the Thurrock area, which is looked after by Basildon Hospital. The middle box is just our key strategic focus to make sure that we offer high-performing services, respond to our communities, we look after our staff, and we strengthen our partnerships. In terms of where we are with the urgent emergency care, and I will stop talking a second, let Tyb come in and add some clinical voice to the presentation. Since the CQC came in, which was just over a year ago, we have increased our staffing in the Basildon ED department, and the particular criticism was observation of patients in the waiting room. And we do know the Basildon emergency department is the busiest in Essex, and has a high number of primary care and walk-in patients. So our waiting room and the supervision of the waiting room is very important because, of course, a patient who walks in can suddenly become very ill, and we need to make sure that we can respond to their needs. We have, and of late over the last 6 weeks, had a very clear target now by the end of the year to get to 74% delivery of all patients being seen in 4 hours, to make sure that we're offloading our ambulances in less than 30 minutes as an average, of which about 70% we aim to offload within 15 minutes, so we can keep our community safe, and that we are discharging our patients in a timely way so that we can avoid ambulance queuing. We, roughly speaking, on average will admit about 70 to 80 patients a day, and therefore we will need to discharge 70 to 80 patients a day. I'm pleased to say, Chair, that those all of those objectives are now improving, but I cannot deny, and you no doubt have had concerns expressed by your constituents, that this has been a difficult winter for the NHS, and we have had ambulance delays. Our average has worsened at one point to nearly an hour. For the average offload, that's a significant community risk. I'm pleased to say today it's standing at just over 30 minutes. We will get it back down to our 20-minute standard as the overall average. And we have performance today. It got as low as 65%. We have performance today of 72% of patients being seen in 4 hours. The NHS target for next year is to make sure that by the end of the 26-27 financial year, we will see patients of 85% plus of all patients within 4 hours. Ty, would you like just to add on that point about any actions from a clinical perspective to make sure patients are safe in the ED and the work our clinical colleagues are doing to improve discharge on the wards?
Thank you. And so Basildon Hospital ED department is an intensely busy emergency department, not only in Essex but throughout east of England. And in terms of numbers, we can have attendances anything from 400 to close to 600. Even local events such as, at the moment, there's a meningitis scare in the country in south counties in the south, so that triggers quite a big pressure on our emergency departments. When CQC came, their main concern about our emergency department was in the waiting area, not with the treatment or assessments they were getting once the patient actually came into the emergency department. So there has been a huge amount of focus in the last 9 months on improving our triage times, improving our triage processes, and ensuring that patients are seen by a clinician of significant seniority as soon as they come in to the hospital. So we have roving nurses, for example, who would actually check on the patients as they are waiting in the chairs and identify patients who may actually need immediate attention, and then they are often, taken out of the queue so that they can be assessed and treated. The second concern from the CQC was about our staffing ratio, especially about the nursing staffing ratio. So significant investment has gone into the nursing staff, as well as some allied health professionals, so that it's not only the doctors but other staff who work in ED, they are sufficiently skilled. We've got the sufficient skill mix to actually treat patients. The pressure on EDs then multiplied by on days when we do not have enough discharges. As Andrew said, if we are admitting 80 patients, we will need to discharge at least 80 patients just to stay even. But there are certain days when this equilibrium is actually disturbed, especially on a Sunday going into Monday, and often sometimes we have to recover by Tuesday morning. The reasons for why discharges are sometimes delayed are multifaceted: the complexity of the patients, the requirement for them to have access care, be it social care or medical care in the community. So there are lots of alternative clinical pathways. We are working with our community partners, with our ICB, working on innovative schemes such as virtual wards, where patients can be discharged from the hospital into a virtual ward under the care of a clinician. And a lot of these initiatives are very much to provide support to the emergency department. Having said that, we have had a very challenging winter, and there have been times when we have had to care for patients in our ward corridors. We have done that in a very controlled manner to ensure that these patients receive the same level of care as another patient in the ward would, and that is by means of providing them all the support, checking on these patients regularly. What that has helped is actually reduce the pressure on the emergency department itself, because it's better that the patients actually are managed in a controlled environment of a ward rather than queuing up in the corridors of the emergency department. So in relative terms, it's a better scheme that we operate. And when I say we do it in a controlled manner, we assess that every evening at 4:30, and then going into our meetings late into about last meeting is at about 9 o'clock. When we plan these movements of patients into what we call as an escalation area, or common use term in technical terms is our full capacity protocol. And usually a person of seniority, either a director of nursing or a medical director, will authorize the transfer of these patients from the emergency department into the ward area to ensure that the right people are actually going to these areas. Emergency department remains under pressure, under significant pressure. We are investing heavily in trying to recruit the right level of medical staff to these areas. That has meant that we sometimes have had to go to overseas to recruit our consultant staff, as well as what we call as a middle grade tiers of doctors. And then also at the same time training and upskilling our own doctors so that they can be the future consultants in the emergency department.
Thank you, Tab. I'm going to, Chair, very quickly conclude 2 or 3 other points, because I'm conscious there must be many questions that wish to be answered. Yes, indeed. I think that's enough said on urgent emergency care. We'll take any questions, other than to say we do intend to eliminate patients having to be kept in corridors on the wards in the way that Tab has described by the end of April. That's our intention. I can't give an absolute guarantee, but it's our intention, and it's all about getting this admission and discharge in equilibrium. We are opening an additional ward at Basildon in the summer, specifically for renal care, that will then allow the hospital to have some additional capacity created, ready for next winter. So that is a positive step to let councillors be aware of. In terms of the leadership change, a new chief executive is being appointed this week. We will be making an announcement as part of the organisational change and refresh, and we've been enhancing the management capability of our hospitals, so that you as councillors I would very much want you not only to work with the whole trust, but have a very strong relationship with Basildon Hospital for your local community. On the waiting list side, which is an equal pressure for us, there are currently just around 900 patients in the Basildon and Thurrock catchment area for Basildon Hospital who are currently still waiting more than 65 weeks for the treatment. The intention in Q1 and Q2 of the new year is to get that to 0. And we are providing capacity both through using other hospitals to offer us capacity. So you are probably aware some patients are being offered to have their treatment in other hospitals to make sure that we can get them off the waiting list. We are increasing the amount of clinics that we're undertaking. So I don't want members to feel that is other than an absolute focus, hence it's in the boxes in the presentation that we provided. I think I'll stop there, Councillor, because I can go on more, but I'm conscious I could talk all evening and that's not fair to the scrutiny process. So shall we start with questions at that point?
Yeah, I've got some questions for you. I unfortunately was an inpatient at the beginning of last year, and on 3 occasions. What I noticed was whilst AMU East was fairly calm and tranquil, AMU West was off the planet.
Yeah.
When are you going to do something about that being a mixed ward? Because it was getting out of control overnight. That's
in terms of the level of disturbed patients and the support provided. Whoops. Yeah. Tab, do you want to come in on that point?
Yeah, so AMU West is our primarily a female ward, and absolutely, we strive to have zero tolerance for mixed wards at all. But acute medical areas are unpredictable, and there would be some days when the balance between having the right number of male and female patients just gets so skewed that the aim to actually have single-sex ward becomes very difficult. It's a decision not taken lightly. It must have been a very particularly busy day because anecdotally our acute medical area east is actually the busier of the two because it also hosts our what we know as same-day emergency care. So I would say that actually it's the other way around, but I completely accept that when you were there, it was like AMU West was under pressure.
And so obviously, Councillor, please accept my public apology for any shortfall in quality of care that may have led. To say if we can make sure that we have no patients in the corridor because we can get better equilibrium of admission and discharge, if we can have the capacity to meet, inevitably what always happens is higher length of stay and respiratory patients over the winter period. The fact Basildon has a ward this summer gives the Trust that opportunity. And I think we will accept that in terms of our improvement work, making sure our organisation of our acute medical ward, of which there are 3 wards in total, it is probably the area I would agree, Councillor, where we need to provide more focused improvement, and Tybe is aware of that because I've been discussing it with him this week to make sure that we can get those pathways right. Those wards should be for patients to have rapid assessment and move into the main hospital base. When the main hospital walls get stuck, patients then stay too long, and because by its very nature we can have a mix of both mental health, dementia, acute patients. So I do accept if we don't get it right, those are one of the more challenging wards for our nurses to have to manage.
I think you have to realise that myself, I was in there with a heart condition, and you've got patients screaming and shouting all the time. Now, personally, I up and left because I couldn't deal with it, but that shouldn't happen. That should be contained. I'm not blaming the staff, they did their absolute best to try and sort it out. But this guy was particularly violent, and it shouldn't happen. He should have been removed at the end of the day, okay? Now, it just wasn't me, there was other patients who were so distressed, but they couldn't go anywhere because they were tied to the bed with drips and monitors and everything. But it's totally unacceptable to have women one side, men the other side, and nothing can be done because security can't come down and remove them. If they can't behave, They surely can't be in that ward. It's not fair, it's for sick people. Now that's just one thing. The staff, I will add, were completely stressed out. They worked very, very hard to try and sort out the situation. And they were older ladies who'd obviously been doing the job for many years, but they could not deal with it. It was too much. The waiting room, you say about the triage has improved. When I went there the last time, I got seen very, very quickly, but then I ended up having to wait 3 hours in atrial fibrillation to be seen. Then ambulance offloading, when I have gone in by ambulance, 100%, no fault. They did their job brilliantly. And the other thing I want to say is about when you do get a bed, in 3 days I got moved 6 times to different wards and then back to AMU West. 6 times. It's not acceptable. If the people who are managing the beds can't sort that out, then that's absolutely ridiculous. And yes, I do understand about not enough discharges. You can't take people in unless you've discharged people and you've cleared beds. On the whole, I would say that Basildon Hospital, from my perspective as an inpatient, is absolutely overwhelmed. And it's not through the lack of staff, because the staff are fantastic. So that's just my point of view. Sorry.
I think it's extremely valid, it's very powerful, and I think from patient stories, we as senior leaders will always learn the most. I think you've actually described, and Ty will be my witness, the very discussions I had with the staff on the urgent need for us to improve our emergency care pathways in the hospital, because our staff do have a very, very difficult job, and it's senior leaders' job to support them as best we can, then look after our patients. So if the improvements I think I can now see continue, Councillor, I hope when we come back in future meetings you will see evident improvement, and that ward capacity that will come on stream this summer can't come a moment too soon in terms of our ability then to respond to the population pressure and the demand, because what you're describing is the negative effects of an overcrowded hospital, which is what we need to make sure it flows better, has the capacity, and our staff feel supported. And if they feel supported, our patients are supported.
Okay, just one other thing. I am a retired palliative care nurse, so I'm looking at it from a professional point of view as well, and seeing elderly patients who are sitting there with their dinner on a tray and they can't get to it. And that's just one criticism of the ward management, but everything else was absolutely fine.
And that's equally not acceptable. So I said that's equally not acceptable as well. So we are fully sympathetic to the pressure the staff are under, but I'll come back to the point. Your insight and your experience is salutary for me to hear and for Tyb, and I think I'll use it as a further spur, without mentioning your name, Councillor, to my colleagues tomorrow morning in terms of what we've heard tonight, how important is this improvement work that we're doing is.
Thank you, Chairman. I probably should have said, yeah, I was many years ago now. I actually can't remember the dates, but I was formerly a governor of the hospital many moons ago. Fortunately, since then, I haven't had much cause to go there, but then recently, in the last couple of years, I've spent a lot of time there. So it's not quite 2 years ago, my son was born, so I spent a lot of time at maternity, obviously. And then I don't know, maybe about a month ago, we took him to A&E because he had a temperature, which turned out to be tonsillitis again. So that was 2 trips, and I observed on both occasions that A&E was pretty mental. I mean, it was quite hairy on both occasions, so it wasn't a one-off. So I'm obviously concerned about the impact that's having on the care that our constituents are receiving, and I suppose my first question is, I wonder whether obviously we've got the Pitsea, the diagnostic centre going in, but I am concerned that, I mean, particularly in the area of Billericay that I represent, and just down the road we've got the South Green surgery is now closed, so that entire community is not served by a GP, which obviously is going to have a knock-on impact on A&E. Do you think there is an argument for an urgent treatment centre somewhere in this area to try and pick up some of that slack? My second question kind of really goes back, I guess, to when I was obviously the trips to A&E my thoughts were kind of elsewhere. I spent a lot of hours just sitting around maternity waiting for things to happen, and what I observed was the fabric of the facilities, the fabric of the buildings. You've got some areas, so where the M&S is, that lovely new lobby that you've got over there now, obviously brand spanking new, very nice. A lot of the older parts of the hospital are now looking very, very tired indeed. I think during that whole period, so throughout my wife's pregnancy, we went back there goodness knows how many times, and there was always a bucket collecting something not very pleasant looking, and I dare say it still is. Is there any plan to upgrade some of these facilities which are now looking pretty tired? I've got other questions, but I'll let you deal with those ones first.
So the short answer to both questions is yes, an urgent care centre is an obvious solution to deal with the ongoing overcrowding in the Basildon Accident Emergency Department. The same can be said of Chelmsford as well. Simon from the Integrated Care Board and our primary care colleagues, we would agree, and we are working with our partners in the wider health system to see how urgent care centre solution could be developed. There's an argument, if you look at what London has done, to say that you put your urgent care centre still on the hospital campus because you've got the ability to deal with anybody who then deteriorates, and the public are so used to coming to your hospital campus. What we're going to work out is if we then put it into community, like we have the one at Allsit, would it confidently then decrease people's wish still to attend A&E at the hospital, or would you find you almost increase activity? That's what we've got to work out from a health planning viewpoint. But the answer is yes, because it probably requires some capital resource in the immediate. It's not immediate, but we are talking actively with our primary care colleagues about what can we do in the meantime to look at things like care home avoidance, using our community nursing service to direct people to primary care slots and provide slots in GP surgeries to reduce the need for patients to then come to A&E or get quickly diverted. So the answer to that is yes. And one of the issues I was going to raise, if I had more time, is that one of the, I think, biggest concerns for the Basildon Hospital, and which I think the chairman has also put the finger on, which is the capacity and the quality of the fabric now is showing definite signs of strain. We have a worrying backlog maintenance schedule, breakdowns of our theatres, which has affected our waiting list performance. There's been a regular phenomena. We've had breakdown in heating. We've had water leaks. So we know, and we are now in dialogue with our Department of Health and NHS national colleagues, because when the hospitals merged, we were expecting a better capital expenditure plan. Has turned out to be the case. We're probably about 100+ million difference where we thought we might be. So there are active discussions underway. Of course, that's multi-year in its requirement, but you're absolutely right. It worries me. There's the fabric of the site that we need to respond to. The fact there is an extra wall being built as we speak at the back of the site is a big plus for the hospital, but I don't disagree. It's top priority.
Thank you very much for that. I appreciate that. I wanted to touch on discharge of patients, which you, not any other kind of discharge of patients, which was mentioned, and I appreciate it's quite a multifaceted issue. Obviously, in a past life, I was a cabinet member for housing here, and we did frequently experience quite serious problems with patients being discharged and then basically pitching up at the council needing to be housed. And so obviously, I appreciate you've got to link up with adult social care, various other services. So I suppose my question is, what can we do together to improve the synergies between us, yourselves, county, and the other sort of stakeholders when it comes to discharging a patient? And a slightly boring sort of technical question, I guess, but obviously you're aware that we're going through local government reorganisation at the moment. I gather that the NHS is going to be reorganised into an NHS Essex. What do you perceive as being the big challenges with that changeover, particularly as at the moment all the clinical delivery is through, a lot of it's through adult social care, through Essex County Council. Once that's split up between the different much smaller unitaries that we know we're either going to have 3 or we may have as few as many rather as 5, how will that impact clinical delivery?
Well, you can tell I'm old. I've been through many government reorganisations and local authority reorganisations, and just to say at the outset, the NHS will work with all of our partners regardless. I think the short answer to that question is yes. The opportunity for district, county, unitary, NHS, community partners' ability to work together for discharge is limitless, and we should find ways to do that. And our contact with the council here has always been productive. We use voluntary sector to help with discharge. We use homelessness is one of the bigger complicating factors for discharging patients. Mental health is another factor for discharging patients, and often that is solved at a local district level, isn't it, as well as at county level. We have what's called a discharge hub in the Integrated Care Board, which is a joint venture between the hospital, community partners and the Integrated Care Board, and we have very good and productive relationships with all the local authorities. And I think if officers or councillors are keen, I would be more than happy to facilitate Michelle Stapleton, and many of you might know, who runs that service, to look at how we can get as many joint ventures going as we can across all of our local authority partners. Simon, I think, has been silent so far. Would be able to answer the question about alignment of health and local government reform.
Shall I was just going to add to that that issue around discharge. We've actually got some really good examples across Basildon. Actually, we had some colleagues from Cambridge and Peterborough came to visit our Langdon Health Centre a couple of weeks back to see what they're calling a transfer of care hub live. So coordinated by somebody at the hospital who's saying, right, today we've got, back to Andrew's point, we need to get people out of hospital so that we can deal with the admissions. So today we've got 40 people that are being discharged into the Basildon area. Each of our primary care networks, so representing our local GP practices, are there. We've got adult social care are there. The community teams are there, the nursing teams. And they're going through each individual saying, right, who is this person known to? And somebody says, we know them, they had a fall, that's why they've been admitted. Yeah, and what we're trying to do is to make sure we've got a really safe environment for the individuals to come back to much more quickly. So, and I hear exactly what you were saying. When I first started working in this area, that was one of the first calls I got, was that patients had been dropped off at the council office downstairs, saying, sort this out, the patient's fit to go home. They can't live in that first floor flat anymore because of their hip operation or whatever. So very aware of that, but I'm very pleased with the progress I think we've made. Those meetings, say that is, it sounds quite simple, but it's quite cutting edge as well. So colleagues from Cambridge were kind of going, wow, we don't do that. We're still working in silos. So I hope that there's more of that to do, of course, but it's definitely in the right direction. And in terms of the ICB changes, it's massive, it's huge. We're becoming Essex. But I feel like I've not been quite around as long as Andrew, but I've been around a long time. And I do feel for the first time that this NHS reorganisation is very much aligned to what the local government reform is going to be as well. So instead of just going, well, it doesn't matter, we're just going to be North and South Essex, or we're going to be East and West Essex, we've restructuring, we've got people in place, but we're actually waiting to see what the result of LGR is before we align our places as well, which I think makes a lot more sense and should have been done a long time ago, really, but it hasn't. But I feel more confident this time that we're a bit more aligned to that. it's going to be ever so complicated. There's no doubt about that. For you guys, it must be the biggest reform that I'm aware of as well in terms of those what that's going to look like. So, but yeah, I feel like as health partners, we're much more aligned to it than we ever have before.
Thank you, Chairman. I'd like to thank the officers of the health service and doctors for coming along this evening, because it's so important to us and our constituents that they get the health care that's required. And I totally understand the pressures that you are all under. I've got a number of questions and I'll read them off, and hopefully you'll be able to answer some of them at least. Just going back on the point that the Chairman made about having to give some feedback to you after such a long time, it's so important that patients can give you feedback so it can be dealt with. Not immediately, but I do understand that you do feedback online, but on that kind of thing, that's so important to give that feedback to you so that you can kind of try to nip it in the bud. So that's one thing. Cancer patients, are you still seeing them in the time scale, like when they're diagnosed? I'll ask all my questions if I may, Chairman, and then I'll get the answers. Elective surgery, that is such a long wait. 65 weeks is such a long wait, and I know a number of constituents that are waiting. I just wanted to say that. I understand that it's very, very long when you're suffering. My colleague, Councillor Schrader, brought up about the homes, etc. Now, last year we had Pam Green come and speak to us, and it's about the building of the houses and the surgeries, etc. Well, I was, when I spoke to Pam and questioned her about those houses, we are, sorry, Grant, I can't say Andrew. I asked her what plan there was for the health service, because we are passing this, planning committee are passing hundreds and hundreds of homes. We know they're not going to be built tomorrow. They know it will be over a period of time, but it's that money that goes to the health service. I mean, I was here last week with speaking. I wasn't on the planning committee speaking. There was 300, there's going to be 700 homes in total in my home, my ward of Note Bridge. 300 were passed last week. Now we've got one medical centre, and there's something in Whitford, but in the Bell houses there's nothing. And I asked her what plan there is to deal with this money, because there was 148,000 maybe over three years, because there's 3 phases. So how are you dealing with that with the council? Because as Andrew's mentioned, Councillor Schrader, the South Green one's closed. There's pressure going to be on ours, but in the planning document it said that there's going to be, the money was going to Note Bridge, that's my surgery for Crouch, Knights and Ballard's Walk. Well, they're in Langdon. We're over in Crouch, Castledon. So I'm just, and so I'm glad to have this opportunity to say, you guys must be told and have some kind of plan so that you know where the pressures are, and put those health centres and support the doctors into where because that is most important, because if they can get the care without going into hospital, it's doing, you guys a massive favour. So that's another thing. And then I just want to talk about the car park. I don't know whether it's been any improvement, but it is really, really bad. I have raised it a number of times, because sometimes you can go up and down and round, but it gets dangerous. It gets to the scale where people are going to the top, and in the end it could be, you know, you would not want any accidents to, you know, to happen. So, you know, what kind of management is there on that? So, if you can go anywhere near answering
No, I can go
I'd be
across to those.
grateful.
I think, conscious we need to answer quickly, but Simon and Ty may wish to add. Patient feedback and the responsiveness, very, very important. And obviously, we'll always make sure we respond to any representation councillors want to make as well on behalf of your constituents. So you will always go to your managing director, which is Tybe in that respect. But Tybe, is there anything quickly you wanted to say on patient feedback? Because we are encouraging our staff to make sure we listen to and talk to our patients live, rather than make them write letters to us and complaint letters. That's a very cumbersome way to address concerns and get feedback.
Yeah, well, just very briefly, I think feedback is absolutely, you know, gold dust. We seek feedback formally through the friends and family test. Doctors seek it for their appraisals. We're also encouraging other staff that for every appraisal they should have a certain amount of feedback from the patients. But also, I think what's probably more powerful is informal feedback, with people writing letters, either they be letters of thanks or letters of complaints. And I think what we have started doing more and more lately is to anonymously share those publicly. We have a one-team meeting in the morning, so if there's a compliment or a serious complaint with lessons to be learned, we make sure that we actually share that with as much staff as possible.
We can always do more, but our staff are very attentive. Cancer, the Trust is still in the bottom 10 for cancer waiting times. Our cancer treatment, the Essex cancer treatment outcomes do suggest that we could do better. I don't have the exact number in my head in terms of your the 5-year survival for cancer treatments in Essex compared to the national. We are lower than the national average, so we know it is a service we need to do better across the Trust. Today there are 453 patients who've been waiting more than 62 days to start their treatment or have confirmed diagnosis that they don't have cancer. That is about 250 less than it was this time last year, so that's an improvement, but it should really be 0 is the short answer. The national expectation is 85% of all patients would have their diagnosis in 62 days. At present, we're only about 50% of all our patients. And that's diagnosis as well as treatment, so that's as much somebody who might be worried they've got cancer and we're just taking too long to tell them that they're okay. And that's as important as is about actually starting the cancer treatment. So that is in line with our capacity plans on the elective surgery and elective clinics. That's how we address cancer and how we get speedy diagnosis. And that's why, as and when the PITSI CDC opens in the summer of next year, with 8 endoscopy rooms, further CT and MRI scanning, that's going to help cancer significantly, because the faster we can diagnose patients, then the faster we can get them through the treatment pathway and the faster we can confirm they don't have cancer. Remember, not far short of 100,000 patients a year are referred to us on the 2-week cancer pathway. So the quicker we can get all of those out who don't need treatment, it avoids spending too much time on patients who don't need it, so we concentrate on the patients who do need the treatment. So I think we'll be looking for a big step change as our diagnostic centres come on stream, and we'll provide an additional capacity, as I mentioned, which does mean you may get some comments from your constituents, because we are encouraging patients to go to Southend, to either go to the private sector or to go to Colchester and Chelmsford, to make sure that we can make sure they get there. If they can't go, that we understand that, but that's one way we're going to get patients treated more quickly to address the backlog. 44,000 patients on our waiting list is not far short of about 10% of the population that the hospital serves, so we've got to eat into that waiting list significantly, and our estate difficulties, as we just discussed, haven't helped matters. Remember, last year Basildon lost 2 theatres all year due to serious malfunction that required a full rebuild of the theatres. The answer on 106 planning and capacity, Simon will talk about primary care, which is, I think, how your constituents will see it most, because of getting access and registered with a GP. The hospital is working directly now with the region and the Department of Health around sizing for the future, in terms of how the hospitals deal with the population growth. Part of the answer also to deal with that population growth is how do we make sure we can provide alternatives like community diagnostic centres, So increasingly patients can be treated not needing a hospital, but through outpatient routes. But I think you're right, Councillor. I would have thought the next 5-year, 10-year building plan for the NHS has got to really reflect the significant population growth occurring across the whole of the Mid and South Essex area. So we are planning. The fact the ward's opening at Basildon is a big step forward as far as that is concerned. Primary care, very quickly, Simon.
I think it's fair to say we're concerned about the growth, particularly in that Billericay area, and we're working more closely than we ever have before with council colleagues, the planning department and housing, to understand what's gone into the plan. And we've almost done things separately. You know, you said about £125,000, whatever it is there for section of 106 money, and we have little pockets of that appear, but it's not really much use on its own. And working with the council and with our clinical colleagues as well, and Billericay's come out as the area where we most recognise there will need to be something significant built there, not just an extension of existing premises. It would have to be a new build that would be purposely for that population. And what we've been working with the council team is in the same way that they look at how they develop schools, the mapping, the heat mapping they do around that. We're saying, well, actually, why don't we do exactly the same with health? So we're working together, which we haven't really done that detail before. And as you say, Andrew, it's probably a sort of 5 to 10 year plan that will address that. Again, complicated because we've got lots of GPs in the area who own their own buildings, who perhaps want to stay in their own buildings, but actually if you kind of say, where do we want to be in 5, 10 years' time, we want a purpose-built facility that will address some of the concerns that you've raised and that keeps people at hospital.
Thank you very much, Chair. I'm going to face forwards because I'm either not facing the camera or but it's all very complicated. Now, myself and Mr Taylor came in last year and we met with Tyab and a few other of the executives that you've got there. So I'm glad to see that since we've been in, you've got some definite plans as to pinpoint when you need things done by. But I think one of the important things that hasn't been mentioned with the ED is we saw some figures. There are an awful lot of people still attending the emergency department that don't need to be there. There was quite a lot that were being discharged or not even being seen to be in there. They don't need to be there. They're going home without any treatment. And I think we all need to do something about that fact as well. There are other outlets. There's pharmacies that can see to a lot of patients. There are people who think they need a doctor's appointment same day. They don't, but they're coming to you. I think we need to try and sort of let the public know that sometimes patience is a virtue. They're clogging up A&E for other people that need it, and I think we need to sort of make it a bit more out there as to what our residents can be doing rather than going down there.
I don't think I need to answer that. We would fully agree. Every single day there'll be patients attending the accident emergency department who don't need to be there, and we've done many audits that would confirm that. It is about communication, access to primary care. It's about reassuring members of the public. So I think, Councillor, it's a huge topic, but if there's something we can do together on that particular in terms of communication with local populations, we're delighted. Tyab, did you want to add anything? It's
absolutely correct. I mean, as I said, on average, 500 patients attend our ED. About 80 of them get admitted. You can probably say another 80 of them needed to attend ED, but the other 300 didn't. So that's the stark reality of, I absolutely agree with the councillor.
Is there any way you can split minors from majors in ED?
Yes, that is we have 2 halves of the department now, but it's too small. And the urgent care treatment centre that we've earlier talked about would do exactly that, Councillor Chairman. It would, if we can either locate it on the hospital site or in other parts of the country, they sit in the community, you would obviously have a completely separate area. If you go to Whipps Cross, for example, you don't get access to the accident emergency department unless you come in via ambulance. You go via the urgent care centre, where you're then treated there, and then the determination is made whether you are serious enough to meet the protocol to go to the accident emergency. And that's why in NHS, MSE, the trust here, and Basildon, we are probably one of the fewer hospitals who don't have an urgent care route in through to A&E. Our problem is, when you look at the site, unless we can get some movement, and by that I mean, if you think of the way A&E is currently built, we've got endoscopy to one side, we've got the paediatric department but in the corridor at the other, we've got the roads around. It's quite hard, councillor, to see how we can get a full UTC type venture move in at Basel without some form of capital development, and that's been some of the hold up. So that's what, in my earlier question, that's what we've got to explore. What we do know, and Simon can confirm this, is the Health Authority or the Integrated Care Board have said that urgent care centres for Mid and South Essex is a top priority as a way to act as a buffer between the hospital and primary care, and that is what we're actively exploring as we speak at the moment.
Right, because my question is, if I go in there with atrial fibrillation, I've followed a protocol before I go to hospital. When my blood pressure is over 220, I need to be seen. I don't need to be waiting in a waiting room.
Correct.
That's absolutely packed out. And I would suggest, from my personal point of view, is of the majors, people waiting on one side and the minors in that great big room on the other side. It is really frightening when you go in and you know your blood pressure's through the roof and there's nothing you can do because you've taken the medication and you just got to wait.
And in hours, by that I mean up until 8 o'clock in the evening, we have councillors, you're aware, because you are on the ward half of it in terms of Langdon West and AMU East, we have the same day emergency care department, and its purpose is to identify patients such as yourself so that they can be picked up and moved straight out of ED, or even be referred in directly by the GP to see the physicians in that department and bypass any. So we have that facility already. What I'm talking about for an urgent care centre is how we would then deal with the very large number of walk-in patients that we see now. Ty, would you like to say any more about same-day emergency care? Because there's a pathway I would have thought we should use in the types of conditions you described.
Yeah, so we have got clinicians who are visiting emergency department. These are specialists, and they're trying to pull the patients out of emergency department into acute medical unit east, where we run the STEC. But you're absolutely right. It does not guarantee that every patient is going to be pulled out. So, yeah, your point is absolutely valid too.
I've just got one other question to the chat about GP surgeries. This new system, Accurix, where we have to go on and book an appointment, well, I can't work it out, and I've been using a computer since 1995. And I went in yesterday to try and get an appointment, and I was promptly told that she can send a message, but she can't book me an appointment. Now, that is absolutely ridiculous that I've gone over there to make sure that I can see a doctor that day because it was urgent. I don't muck about. I'm not going in there messing about. I needed to see the GP. Fortunately, the GP who was on call picked it up. But her attitude was, well, I can send an email. It's not good enough. They need to book an appointment. If you turn up there in person, you're not messing about, you're serious. So this Accurix thing, you've either got to hold classes on how to use it, or you've got to book appointments. Okay? Thank you.
And I completely get that as well. I mean, the NHS 10-year plan is very much looking towards us using digital technology, but that only works if we know how to use it and if it's fit for purpose. Funny you should say about classes though, but because we are doing some, not necessarily on wholesale on Accurix, but again using Langdon as an example, they're running a digi-hub there to get people who are not tech savvy at all, but to get them to be able to use their laptops or phones, the NHS app, which is where everything's going. Everything's pushing towards the NHS app, but people will be left behind if we don't provide that support to them. So it's a really helpful point because some places it works really well, but others I've heard similar things that actually patients are frustrated. In fact, your chap on the door downstairs, I was having a quick chat with him about his experience, and he said the same thing. He'd tried to do it online, and eventually was told you just need to call your practice. He said, well, what was the point of me going online if I'm ultimately told to go back and use the phone, which is what we're trying to avoid, so that everyone's not rushing at 8 o'clock in the morning to try and get an appointment. So,
yeah, but
it'll get better.
the problem with Langdon, with respect, is they have one desk open and 5 or 6 people sitting at the back. They've got the covers down, and they won't come and deal with the queue that's out the door and down the stairs. It's ridiculous. And then you get to the desk and she says, I'll send an email. I can't book an appointment. If she booked the appointment, it'd be done and done with. But it's just crazy. So, thank you.
Thank you. I'll pick that up with the practice, because they are one of our they're one of our beacons, and they'll take that feedback for sure. Thank you.
Thank you, Chairman. I just wanted to say something on the same thing, Simon. It happens at our practice. There are so many people that can't work the accuracy, but even if you do, it's, you know, you have to give me a life story. I understand how you want it to work, but it doesn't work all the time, and it doesn't work efficiently. And as the Chairman's just explained, I had a constituent that needed something or other, and in the end I said, write a letter and I will take it to the surgery for you. But when I took it to the surgery, they told me they do not take hard copies. So I said, well, I took my laptop to the constituent, tried to do it, but it wouldn't take the attachment. So I said, write the letter and I will, but they wouldn't take it. I mean, it really is quite outrageous. It's okay for people like me that knows how to speak up, but it doesn't make things right for me, because it just doesn't work. There just doesn't seem any other way. You've got people that are in their 80s, 70s, sometimes 60s or even 50s that still can't work the system, but they're told, use the app, use the app. Well, they don't know what an app is, you know. And I mean, I know you're doing all the digital training, and I would hope that this council would try to give residents, but there are some residents that are never going to do it, never. You know, you're going to get a generation in X amount of years' time, everyone will be able to do it, but I think you're dealing with a number of people that are not prepared to do it, can't do it and won't do it. So I mean, if you can try to give that feedback to someone and try and get something back to the chairman so that we can say, well, okay, how can we improve it so that it works? Because you've got a practice where before COVID you could go to and they did so much, they were so good and it was so different. But now, post-COVID, it's like, don't come here, you just use the Accurex, and until you get your head around it, you don't know what the Accurex is, if that's the right terminology for it. But if you could just give it some feedback, because I'm sure it isn't just, it must be all over. Do you get that, Andrew?
Yeah.
Yeah.
And I would say it's probably not just patients. Some of our GPs probably feel the same, trying to adopt this new technology, but they've kind of been forced to as well. So you mentioned COVID. I think that accelerated what was probably a 10-year vision, that we would move to more things happening electronically. But actually, during that time, it was literally a lifesaver that we could communicate with patients by video links, by telephone, and it was a game changer. From October last year, national policy is every GP surgery has to have online consultations switched on from 8 a.m. till 6:30 in the evening. very stressful for GPs because they can't miss any of those. If something comes in online that's an emergency, they can't afford to miss that. So they've had to change completely the way they work as well. So I guess everyone's adapting at the same time. And what you've got is a GP and a non-clinical member of staff looking at all that stuff coming in, and ideally what we're trying to do is say, I need to see that patient today, or at least have a phone call with them straight away and decide if we bring them in. And that patient, we'll call them tomorrow. We'll get back to them, but we'll call them tomorrow because it doesn't seem quite as urgent. And that patient will be next week because that's more of a routine diabetes check. And that's what we're trying to do, is get away from that 8 o'clock in the morning where everyone's on the phone trying to book an appointment. And once 100 appointments have been made, that's it. It doesn't matter how urgent it is. That's it. All the appointments are taken. And you might end up with people who, a bit like your A&E statements, people who are ending up having an appointment who don't need to be there on that day and taking up the appointments that are needed by those who are more urgent. So there's a kind of theory, but there's a transition to get there, isn't there? As you say, there's probably 5-10 years this conversation won't be happening, but how do we make sure that we make it fair and safe for those individuals at the moment? And what should happen in theory is, if you're not able to do that online, you should be able to do it over the telephone or face-to-face with a trained receptionist. You still be asked lots of questions to be triaged by a clinician, but there shouldn't be a disparity as you've described. So we'll certainly feed that back. Thank you.
Okay, thank you very much for coming along. It's been very interesting.
It's been helpful, certainly very helpful for us to hear the direct.
I hope we haven't
concerns.
frightened you too much.
Not at all, no. We'll be more than willing to come as often and as frequently as is required. I think the more we talk to each other and work together, the better.
Yeah, I'm happy to talk to you anytime. Thank you very much.
Other than that, thank you, Chair. Thank you so much. We'll be in touch.
Thanks for coming.
Thank you.
Right, if it's okay with everybody else, what I was thinking of doing is having the 2 performance updates from community transport and then citizens' advice, and then we'll go on to the area committees so you don't have to hang around. So, who wants to go first, community transport or citizens' advice? Do you want to take it away then?
Okay, so we was with you guys nearly 11 months ago. We sat in the same seat here, and we were telling you...
Excuse me, just a moment.
Sorry. You good? Yeah. So, 11 months ago we were sitting in the same seat talking to you, how well we've done, what we're doing, and also some of our struggles, and you listened to us. At that time we were full to capacity because there was a big need for the service, and we couldn't fulfil that capacity. So we looked at what we was doing, and we threw more man driver hours at it, more vehicles at it, and we managed to clear our waiting lists. We're back to where we was before. We've now got a waiting list because there's such a big demand keep coming in for our services. So we're growing, we've got more vehicles, we've got more drivers, we've got more admin in the office, that we're outgrowing where we live basically, and the demand is just getting bigger and bigger all the time. Also, we struggled also with the increase in ERNI and the minimum wage increase is going up. So every year it's been like 10% for the past 2 years, it's another 4.1% this year, and that's a big expense that we have to find. So we know all those things, but we work with them. Some of the really great news is because we are a charity, we can look for other funding sources. And we were really successful from the mobility grant. So we got a 3-year funding, and we got £209,000 there over the 3 years, which is absolutely fantastic. It is fantastic. But the purpose of that grant is to support people who've got disabilities, mobility disabilities, to access health services. So it enabled us to have a driver and buy a minibus, purpose-built minibus just for that. So we go out of area now, we'll go towards it. One of the big things is we go to Barleyland's Eye Clinic. Yeah. People can't access these services, so now we've got a service that they can. And that comes under a separate basket, because that's a separate service within our services. So it's not what Basildon Council fund, that's funded by the Mobility Fund. So that is excellent news that we can take more passengers on that specific service. So we're growing, everything we're doing, there's growth in, but we're hitting a brick wall now, because how big can we grow? Because the need is too big. But it is good news for us, and already now, this is 11 months that we've come back, because we still haven't done our Q4 figures yet, and we're already 20% up on our passenger figures. So we know there is a need for service, but we also know there's a lot more higher costs coming out as well, and the fuel at the moment, everything is expensive. So we've also told this week that Essex County Council are supporting us for another year, and they've also given us an additional grant to help us through for 2026, 2027. So we're looking for some more support from Basildon.
And how much will that grant be, do you know?
The additional support grant, it's 48,000, and what we're planning to do with that, there's an unmet need in the North Wickford area. We're going to introduce a bus service for the people, for the residents that live in North Wickford, and that'll run 3 times a week. And also it will help to build the capacity up. It will enable us to employ another driver, which means we can then take more people on board.
Wow, that's fantastic.
It is fantastic, and I've got a great team, and we're just growing all the time. But we are hitting a block now, because how many minibuses can we park in that car park? How many staff are going to fit in the office? You know, so how big do we grow? That's another question, isn't it? Because the demand, there's more people with dementia, there's more mental health issue needs, there's so much growth. We've got so many demands now, and it's different demands, which you can evidence, can't you, from taking the telephone calls?
Yeah.
No, I think you're doing a fantastic job. Well done.
What do you see, what do you want from us? What do you see our future as? What do you guys see us as?
I like to see you get a lot more money. We'll have to wait a little while. Why? Well, we've got an election. So yeah, no, I agree with you. It needs to be looked at. Absolutely.
Thank you, Chairman. Yeah, as I mentioned earlier, I was a director of BTCS about nearly a decade ago now, I think, wasn't it? Yeah, I wasn't going to mention that, but yeah, it's good to see you both. And of course, I was on that along with my old friend, former councillor, the late Ron Livesey, who was quite a character. I was always really impressed by BCTS. I think the commitment of everyone there is incredible, and it's good to see you've gone from strength to strength. And I do see the buses driving around Billericay every now and again. Whenever I see one, I always go, ah. It was interesting the point you made. Obviously, yeah, you are a bit limited growth-wise at the George Herd. I wonder, I mean, I don't want to commit officers to anything. I wondered if anyone has looked at the possibility of some co-location here in this building, because certainly we used to have lots of empty floors. I don't know if we still do. We might have come up with some clever way of rationalising them, but I can remember walking around this building a few years ago and there was whole floors with nothing on them. And I just wondered if there was any capacity to, like maybe we can find some way of assisting with the parking situation. Certainly, once the car park downstairs has been sorted, and we just found out the other day that the council's taking over some of the other car parks in the town centre. So it's just whether there's any options for us to assist with some of those issues. The capacity issue at the George Herd. Obviously, you can only expand as much as the capacity of those sites will allow you. So. I mean, have you looked at any other potential locations that would allow you to grow in the way that you want to?
See, also, it's not just office space. We need secure parking space for the minibuses, because we do get vandalism and things like that. We're very lucky at the George Herd that we've got the gates that close and it's as protected. If you remember, was it last year we were talking about the rats that were chewing the wires? So There's lots of thought. You can't just do something overnight. There has to be a lot of planning. It's just that we're just looking at our services now. We know there's unmet demand. We know there's potential growth in people wanting to use the service. And we need to think, well, do we just tailor this need? Where do we go? What is it you guys want us to do?
Well, Tina, it's a better story this year, isn't it? I remember the rats for 2 years. Have they given up? They're still there, chewing up. Costing you lots of money. Really pleased to hear it, and the fact that you're getting some additional funding, much more funding in. And it would be nice if the council could shove its hand back in its pocket, because you know, I cut it some time ago, a long time ago, but it's never been given back to you, and we're not in administration now, so I'll put something out to the cabinet member that's sitting there and say, can we look at that? But I think you know, I don't know, that's not I can just ask the question on your behalf, but I think my colleague, Councillor Schrader's made a good point on office space. In relation to buses, goodness knows what would happen there, but I mean the staff, you know, the officers, they might be able to come up with something for you. But I've certainly seen lots more of your buses really are getting around, because I'm thinking, what is going on? And now I know. So, and I'm really pleased that you're shifting the service as well, Tina. So well done to all of you. It's great to hear. And I hope that you can get offered something bigger so that you can grow, because the council needs you to grow, and we need you to meet that demand as well, because we've got this population that's needing you, and it's not necessarily the old, what you're doing for the disabled is fantastic. So I mean, we must try to support you as much as we can. So let's hope.
Can I just ask you? You sat here tonight and you were telling us about all these new builds that are going on. Is there any way we can tap into the Section 106 money? Because what's happening to the transport infrastructure? You're building all these new houses and things. Where's your transport infrastructure plan? Can we be included in that?
Good question.
So I don't have a planner with me to answer that, but obviously Essex are the Transport Authority and do participate in all of that, and obviously Essex are your co-funders. Yeah. So whilst I don't have the answer, I'm pretty clear that will be taking place. It's might be about getting that exposed to you, I think.
So we want to be included.
Yeah. Right, any more questions? No? Okay, thank you very much for coming along. Well done. Brilliant job.
It's a great team.
My recommendation would be get onto your county councillors. Absolutely. Essex should pay for this. According to Councillor Callaghan, there's 169 million sitting in the box. 169 million sitting in Essex County Council's coffers.
Well, that's according to someone, so I don't think...
No, that's he...
Well, that's down to the Essex County Council.
I'm not arguing with you, I'm just saying that's what was said, that's what's out there. You need to speak to your county councillors and make sure they're paying it out.
And when will we know if Basel will also be supporting this issue?
I don't know, I can't answer that question at the moment. But we will ask. We won't just leave it.
Thank you.
That's all right. Thanks for coming along. Thanks, Melissa, for coming. Right, on to the next item. Citizens' advice. Thank you for waiting. Bless you.
Okay, you've had.
I think Councillor Ferguson will give the.
Oh,
Thank you, Chair. And firstly, may I thank Cathy for attending tonight's meeting to be able to update on the work of the Citizens Advice Bureau that provides valuable support and services to our residents, as indicated within the report, across a broad range of areas that residents are coming to the Citizens Advice Bureau, being able to get advice from members of their team and dedicated volunteers that they have. And I want to place on record my thanks to them for their work. We've worked within different financial constraints this year than we have done previously, and worked collectively with the services that we're able to, and want to thank the Citizens Advice Bureau for how they've adapted and adjusted to the new support and systems that are in place. As we can see within the report, there's clear need for support being provided to residents. There's a number of residents that are coming forward, often with multitude of cases being raised with the Citizens Advice Bureau, and it's right that there is an independent support service that is out there for residents to be able to access support, particularly in being able to raise issues with the council on their behalf. So I'll happily take any questions, but at this point I'll pass over to Cathy to go further into more information.
and apologies for being so keen to jump in there. Okay, you've got various statistics from us in your report. I thought I'd give you a few extra bits of information to hopefully make it a bit more interesting for you. So we're on target to see 2,500 clients in this financial year in the reprioritised areas of focus. So we anticipate a value to the council of about £40 per client. We operate 4 days a week at the moment in the Basildon Centre, offering a mix of telephone appointments and drop-in sessions and face-to-face appointments. In terms of the value, there's lots of areas that we also offer value. So, for example, with our debt clients, we write off a certain amount of debt for them when we do things like debt relief orders or bankruptcy. And a total in the first 3 quarters of this year was just over £787,000 written off. I think you'll agree that's a huge sum of money. On top of that, the top 2 debt issues this year that we're seeing are council tax arrears coming in just very slightly ahead of fuel debt. That is up to the 31st of December. That's likely to change in light of some of the changes recently. But it gives you a flavour for the type of debts that people are coming in with. We put in the first 3 quarters of the year 203 local residents into breathing space. That's a type of debt assistance where, a bit like it says on the tin, they get a breathing space 90 days, not to do nothing, but to work on a long-term sustainable plan. And we have to put them in, we have to do a midpoint review as a minimum, have a plan with them, and then get them out of it. 56% of our clients have a disability or a long-term health condition. So that gives you a bit of a flavour for the more vulnerable clients that we're trying to help. We're regulated by the Financial Conduct Authority to deliver debt advice. To deliver debt advice, you must be regulated to do that. We're also registered with the Immigration Advice Authority to deliver at level 1. Anything over level 1 we refer on to our national team, and we deal with that on the phone through the national team. We mentioned our volunteers, they're worth their weight in gold. We've currently got 31 of them doing about an average of about 6 hours a week each. We estimate their value to be over £250,000 a year. I would say probably more than that, they're worth their weight in gold. Although we have had a reduction in funding from you, we never stop trying to get in additional funding to help local residents. So we have a variety of other funders. Things like the Access to Justice Foundation help us fund our law clinic, where we work with pro bono solicitors to provide free legal advice. We've got funding in from Macmillan, which again is to help people who are quite vulnerable. From the Money Advice Trust to help people with specialist debt advice. From the MOJ through a probation service to help male probationers. And we're also now working with Basildon Food Bank. That started about 9 months ago, 10 months ago. And so we're across the road and in Pitsea helping them as well. The total of all of that funding, and there's a couple of others that I've not mentioned, is over 390,000 for this financial year. So we're working hard to try to get more money in, but I won't deny it's been difficult adjusting to lower funding from the council and reprioritised areas. In addition, we've done a big lottery bid, which is to try and increase services within 3 local authority areas, Basildon being one of them. We're through to stage 2, so it's not a definite yet, but it's a promising, warm lead, shall we say. So I've thrown in the mix there, hopefully some things that reassure you with the additional work that we're trying to do. But do you have any questions you'd like to ask me?
Kathy, you're doing a fantastic job. I don't think you could ever fail. This service is so valuable. So you've demonstrated it in what you've just said. You know, the people that you help and that have taken that help. You know, the fact that they've got breathing space that helps them. I mean, it's unbelievable. And one thing I've got to say, I was absolutely outraged last year when you lost half of your funding from Basildon Council, considering several years ago, I, as the then Cabinet member, brought all those advice services together in one, put it under the CAB, and gave you that kind of money because it was absolutely necessary. And for you to have had it removed, but you haven't sat on your laurels, you've gone on to get even more funding. But this is what the voluntary sector is all about. You just can't rely, nobody can, I understand that, nobody can rely on funding from local councils anymore. That, you know, they're going poor themselves. But nonetheless, we should support people that carry out the service, just like the transport and like yourself, the advice. We should be putting the money there because of what we actually did at that time and brought that all together to make it the success, because it's far more successful now than it's ever been. So I've got no questions for you, but I just understand, and I understand Kathy's told us tonight that she is retiring, and I wish her the absolute best of a nice retirement. Thank you so much for what you've done to the people of this borough and beyond for all those years. And Kathy, before you go, make sure you ask for a little bit more money, because I certainly will at some stage or another. So thank you. Thank you, Chairman.
Thank you for your kind words.
Thank you, Chair. Councillor Sergeant stole my thunder. I was going to thank you at the end of the meeting for your years of dedication and service and support to residents across the borough, and just echo those comments because it is valued and it is appreciated. I do want to touch on the comments from Councillor Sergeant there around funding decisions that were made 12 months ago, and we had a difficult financial situation that we inherited when we came back into the council. There were difficult decisions that had to be made. But actually what we looked at doing was ensuring the first priority was about ensuring that there was support for residents where they needed it the most, at the time and at the place that they needed it the most. And integral to that was a continuing relationship with the Citizens Advice Bureau. There can be no doubts that is different, and the funding levels are different. But the safety net being out there and a committed relationship to ensure residents are supported was absolutely integral to the redesign of our services. But I do think it's important to be able to point out that matched with redesign of services was also the investment in the social prescribing tool with Access Elemental that we presented at the last meeting, where we were able to demonstrate the wide variety of support systems that are out there for residents at the time and at the place that they need them, recognising that residents will engage with the council for forms of support at different times and different spaces that they need. They'll engage with other organisations across the borough at different times and different spaces. So actually it's about bringing that all together. So rather than just looking at this in one particular isolation, I think we need to look at the overall support package for residents, which has increased. It's adapted and moved forwards, but working centrally with the Citizens Advice Bureau, because they're an integral partner to this council and will continue to be so.
Thank you, Chairman, and yeah, thank you, Cathy. I did, I think, 2 separate stints on the board of the CAB, again, some years ago, and I was always very impressed by the CAB generally, but by you in particular, I must say. So thank you for your years of service. Look, I won't make any bones about it. I mean, as Councillor Sargent said, we disagreed very profoundly with the decision to more than halve the grant to the CAB. I thought that was the wrong decision at the time, and I voted against it accordingly. But it was the administration's decision. I did want to ask what has been the sort of the real life impact of that cut in funding, because I know it was about. I mean, it was half of the grant we give you, but I think it was about 10% of the overall funding of the organisation, about thereabouts. So obviously that must have had an impact on your ability to help. The number of people that you would want to help, and actually, I'm presuming it then leads to more people presenting to the council. So ultimately, a lot of that saving that we made from cutting that grant will probably have come back and hit us in other places, like housing, and the other support services that people rely on. And if they can't get it from you, they'll come try and get it from the council directly. Have you managed to find alternative funding streams, and were you able to obviate any staff reductions, and were any services withdrawn? Because I know there was a question mark over closing down the face-to-face service in Billericay and Wickford and just concentrating everything on Basildon. Certainly I know that you guys used to be based in Bursted Lodge at one point, and I just wondered what's the picture of the sort of the offer to local residents at the moment. Thank you.
Thank you. I won't deny that a cut in funding as significant as the amount we received last year was disappointing. We completely understand the pressure the council is under, but I'd be lying if I said it wasn't disappointing. You wouldn't expect me to say otherwise. It doesn't mean to say that we don't respect the council as a significant funder still, and we always strive to do as much as we possibly can for our local residents with the funding we've got and to get additional funding in. But of course we had to rationalise last year. We had to think quickly and figure out how we were going to make things work. What we had to do was unfortunately centralise services here, and we did close the service in Bursted Lodge in Billericay and in Wickford over on the Wick. We have been looking at that again recently as to whether or not we're in a position to try to reintroduce a face-to-face service in Wickford and Billericay. I'm not saying for definite, but we're looking at whether we can redo something once a month. We've drawn a budget up and it goes before our Finance Committee and our Trustee Board in April. So we'll know more about that in the next couple of months. In terms of staffing and volunteers, we did lose some volunteers because we had to cut some sessions. We always try to keep as many as possible, of course, but we did lose some. We are constantly recruiting more and trying to backfill any that we've lost. In terms of staff, we didn't actually have to make anybody redundant. We were able to draw in some additional funding from elsewhere, and that meant we could reallocate and offer suitable alternative employment to some staff. But what it did mean is we lost some of the specialist services that we had here in Basildon. So we had, for example, a welfare rights specialist, and we also had a housing specialist. Those 2 roles went. The staff themselves have gone on to other things, so don't worry about the people that are doing those roles. But the service has changed in that we don't have that specialist level on hand as easily as we did before.
Thank you, Cathy. If I can come back briefly. What do you see in terms of the forward plan? Obviously, we've got a lot of things on the horizon now. We've got wars going on and God knows what. And that will always have a knock-on impact on cost of living and the kind of things that come up that will drive people to your service, you know, people struggling with debts, people struggling with housing, health, etc. How are you sort of managing that risk, if you like? How do you see the pressure on the service growing? Obviously, not going to be your problem much longer, I suppose. But you know, for your successor, how do you see the pressure on the service growing? And are you confident that you'll be able to meet that demand with the current funding that you have in place, or hope to have in place?
It's a good question. Although I am retiring, I still care passionately about Citizens Advice. I've worked for Citizens Advice for 23 years. You don't suddenly stop caring about it the day you retire. I think we are trying to get additional funding in. So one of the things we're doing is talking to, we're part of the Citizens Advice Essex Consortia, which is all of the Citizens Advice in Essex. We're talking to Essex County Council about the Crisis Resilience Fund. There is a hope that there will be some additional funding through that money to work on a triage service that triages through to the Essential Living Fund. So that's being talked about. It's not definite, so please don't think that that's a given, but it gives you an example of some work that's going on behind the scenes to try and beef up services to meet that demand.
Thank you very much, Kathy, and I hope you enjoy your retirement. I know it's in your blood, so you'll still keep a toe dipped in, I dare say, but try and kick back and relax as well, because you've earned it.
That's my plan.
Thank you, Chairman. I'm coming to Jack again because the point that Councillor Sharda's just raised is so important. Kathy's already said that council tax is just above fuel poverty. Fuel poverty is going to grow, and us as a council, we won't be able to sit back, because if the grants don't come in, the people are not going to get the help. So I mean, you need to be aware of that and be able to deal with it should the need arise. Thank you, Chairman.
Thank you, Chair. Thank you, Kathy, for your remarks and indications as well, and thank you, Councillor Sargent, for quite rightly raising the issue and concerns around the cost of living, particularly in relation to fuel poverty. As 4 years ago, when following the initial invasion of Russia by Putin, the illegal invasion that took place, I remember having exactly the same conversation, sitting around this table actually on the Housing Scrutiny Committee with Councillor Turner at the time, and both of us were in agreement on the levels of support that the Council needed to provide. And I thank our officers for being on the front line, along with our voluntary community sector partners, for being there for our residents, being able to offer advice, being able to make sure that as available grants trickle down to residents to be able to support them, and increasing knowledge and awareness of our residents. Our officers will continue to stand ready, and I'm sure that receives cross-party support, because ultimately we need to make sure that all of our residents get the support that they're entitled to, that they need, particularly at the times that they are most vulnerable.
It's a pleasure. Thank you. Okay, area committee's performance review.
Thank you, Chair. Thank you, members. I'm particularly proud to be able to introduce the report on the area committee's performance review. Also aware that the area committee chairs will be presenting updates at full council tomorrow evening on the work of the area committees over the last 12 months. But I think that the area committees has been a really successful initiative that we've introduced over the last 2 years into the council. As I've pointed out several times previously, that what I think the area committees give the opportunity to do is give all members of the council the opportunity to have a skin in the game, to make decisions on behalf of the residents that they were elected here to serve, with funding pots available to be able to support them and support the priorities that they hear firsthand from their residents. whether that's investments in community centres, whether that's investments in sports organisations, whether that's investments in youth clubs, whether that's investments in SEND provision, being able to trust members across all 14 wards across the borough to be able to make decisions that support the residents that they hear and speak to most, I think is really, really important. And I'm particularly proud as Cabinet member responsible that one of the first decisions I made was actually to give away power so that decision making doesn't stay with me. It actually trusts the experts within the room, which is all 42 members of this council. And I'd like to place on record my thanks to all members of the council that have engaged constructively with the area committee process and have put forward, listened to their residents, put forward causes, championed those at meetings, and then being able to see those come to fruition. Over the last 12 months, we've seen over £651,000 worth of grants being given out, 103 grants in total, and of which 44 charities have been able to benefit. The other thing, and the really useful thing that I think the area committee funding is able to do, and it doesn't necessarily get the recognition that it deserves, is be able to utilise for match funding for organisations that they can bid in funding from the council and their councillors, but they can also apply for other larger funding pots or other funding pots elsewhere that this can contribute towards. And that importance of match funding demonstrates to funders' confidence, and particularly coming from the council, that initiatives are worth investing in. And we see within the report some really important ideas around the leverage funding and the match funding that this has been able to bring in. A significant development across the last 12 months has also been the area committee's investment within the pride teams, and again trusting the councillors that represent their wards to be able to shape the pride services that fit around them, no longer having to send an email inquiry into councillor inquiries that then goes to the cabinet member, and the cabinet member may not represent that particular part of the borough, they may have other priorities, but actually empowering the councillors and the chairs that represent all the areas across the borough to be able to prioritise the pride services within their wards, to work with their ward colleagues to look at the issues that they receive most complaints about, then being able to have a direct link with our environmental services team to be able to shape the works and the planned works that are being undertaken, I think is particularly important. And also then seeing the return of the Crunch programme across the borough, which was very successful 2 weeks ago. We've got another one coming this weekend as well. And I think that's particularly responded to the needs of our residents. I'd also like to thank all of the communities team in being able to work with all of the area committee chairs, all of their members. The area committee chairs meet on a monthly basis, talking about particular priorities, talking about shared learning across the different area committees. Cross-party, really important environment that's been created, and all area committee chairs have engaged constructively within that process. And I'd like to particularly thank Mr Toombs and the communities team with Michelle, Colleen and Jenny for their support in shaping those discussions, supporting their area committee chairs, and Stacey, sorry, in being able to, you weren't in the room, in being able to shape those meetings, shape those discussions that take place with our area committee chairs, because they're particularly valuable in being able to introduce new ideas that come forward. Overall, I think the area committees have been a success. We've continued with our theme of inviting community partners to the area committee chairs meetings to give particular community spotlight and activities and awareness raising activities that are going on, and give members the opportunity to ask questions in a similar form that we ask in scrutiny meetings, but also with more localised partners that are taking part in activities that are going on. So as I reiterate my thanks to our officers, to our area committee chairs, to all members that have engaged constructively within the process. And I hope to see the area committees go from strength to strength. And I invite any questions that come forward.
Thank you, Chairman. Well, I have sort of mixed opinions on the area committees, but I've got some scribbled notes here, and it's headed pros and cons. So it's not all negative, and I would say probably broadly speaking, I feel positively about the area committees, and I do want to put on record my thanks. So obviously I serve on the Billericay area committee, and I do want to record my thanks to Jenny Squibb, the liaison officer, who is a first-class officer and has done great work for us certainly on our committee. So I mean, the first pro I've got here is the liaison officer. I think that's a really valuable contribution. The argument was always that there were always opportunities for people to get funding for for different causes, charities, food banks, that sort of thing. Those opportunities always existed, but they largely had to go through their councillors. And I do think that made the process a little ad hoc. There was, I think, a bit of a perception that, if you were an opposition councillor, then there would be member investments for the administration councillors, but if you found yourself in opposition, that you then couldn't somehow access any of this stuff. But I knew that wasn't true, because I could remember a budget setting when former councillor Stuart Sullivan was the cabinet member for resources, and there was a line item on the budget, and we all said, "What's that for?" I said, "Oh, it's something Kerry Smith's asked for." And as a new councillor, I was like, "Oh, but he's not one of us, is he?" And he said, "Well, he's made a perfectly reasonable request, and we can fund it. So if we can fund it, we should fund it." And that was that put me in my place, and I understood that was how things should work. And I think he was absolutely right to do that. But I think actually having something with a bit of structure, so you don't have to go cap in hand to the cabinet member for resources, and the charities and the community groups and the other sorts of bodies that come to us to request funding from these pots of money, they do have a process they can go through now. They can fill in an expression of interest form. They don't just have to lobby their councillor and then hope that their councillor is sort of charismatic enough to be able to persuade the cabinet member to cough up. So I like that about them. I have questions around the running costs of the committees, whether we have the right makeup of the areas at the moment, but by and large, I don't have too many qualms about it. I do think that the area committees are being asked to fund things that, in my view, should be core service. Things like the Crunch and the Pride teams. I don't think the area committees should be funding those. And noise is off. Brings me neatly to my next point. My major issue with the area committees over the last period that they've been in operation has been the issue of parking charges. Now, I don't know if I'm pretty sure that's been unique to the Billericay Area Committee in terms of I know you guys on the Wickford Area Committee had a good old dust up about it, but I think we were the only committee that was approached to fund this free parking, and basically we said no. Because on principle we were against doing it. So what happened? They took a report to committee, I beg your pardon, they took a report to the Cabinet, and the Cabinet just docked £10,000 off of our budget. So that's my big bee that I have in my bonnet about it. I mean, these were the brainchild of the late David Harrison, but I think he envisaged a far greater level of autonomy for the area committees than they actually have. I mean, they appeared to have that autonomy at first, but then we were presented with this option to cough up 10 grand out of our funding to pay for the parking charges that the administration had introduced in the first place. We said, no, we're not going to do that. And the town council did the same. And so you just took the money off of us anyway. So I have to say, I mean, you were perfectly within it was in your power to do that, but I think that was a really unfortunate decision. I think it's certainly in a lot of my guys' minds, it's undermined the legitimacy of the area committees and what the area committees are supposed to do. It also put the committee in a difficult situation because we had certain projects we were wanting to fund which we then couldn't. We had to drop the CCTV for Festival Gardens, which is in my ward, so I wasn't best pleased about that. But otherwise, like I say, so for me it's a mixed bag. I've by and large thought they're a good thing. I think we've done a lot of good through the Billericay Area Committee. I'm sure all the other area committees have invested in projects that have delivered value and that they think are worthwhile. I like the fact that our community groups now have that kind of structure that they can put their expression of interest form in. They've got support in doing that from Jenny, and whoever the liaison officer for the relevant committee is. And I think that's very valuable because a lot of particularly the smaller charities, I think, struggle with funding applications. They can be a bit daunting. So having a nice friendly face that can talk you through the EOI is to be welcomed. And I think I would reiterate that I think Jenny Squibb has done an absolutely sterling job. But I think if you're going to give these committees the autonomy, give them the autonomy. Don't present them with the option to fund something, and then when we decide we don't want to do it, just simply put a report through Cabinet and take, dock 10 grand off of our wages or, off of our budget, sorry. That I think was fundamentally the wrong thing to do and not in the spirit of what I would have thought David Harrison intended for the area committees. So that's my thoughts. Thank you, Chairman.
Thank you, Chair. Thank you, Councillor Sargent. Firstly, I want to applaud the Cabinet member, Councillor Ferguson, for a sterling presentation. I really do believe his enthusiasm for community action has helped to forge the area committees into a success for the borough. And I'd also want to join Councillor Schrader in putting my thanks on record to the officers behind the scenes, like Jenny Squibb and Dave Toombs, whose passion for our community is an inspiration. And their hard work makes the good work of the area committees possible. And I just want to say, I think it's absolutely right that the whole process for funding awards and considerations places an emphasis on sustainability and value for money. And I've said before, I've quoted a former Prime Minister before, that there's no such thing as government money, only taxpayers' money, and I really do believe that. In my contribution, this is why I was kind of eager to follow on from Councillor Schrader, Councillor Sargent, so I'd like to pick up on the point raised by him and previously by Councillor Barnes in the last year. I can't remember exactly which full council meeting it was, but the point I'd like to pick up on is, we've seen over the last 12 months, different to the first year where the area committees were in operation, that the area committees, I think in this municipal year, have been used as a way to fund pride teams and car parking charge reductions, which I think I agree with Councillor Schrader are an amazing service, and it's not really a kind of an option for me. They are must-haves because they really do make a difference to kind of the running and the look of the borough. And ultimately, I think once those funding decisions are allocated, I think it leaves a lot less left over for community groups and initiatives to invest in local areas and empower the communities, as Councillor Ferguson so eloquently put. So I suppose to kind of pick up on where Councillor Schrader left off, my question to the Cabinet member is there a risk that the area committees become a vehicle for the Cabinet to delegate cuts?
Thank you, Councillor Ansell, for your question, and thank you, Councillor Schrader, for your contribution as well. I think what the area committees give councillors the opportunity to do is decide what are the right investments that councillors want to be able to make in their wards. Councillor Schrader referenced that the crunch was a core service. I must have missed it being a core service from 2021 to 2024 because it wasn't something that was being provided. Therefore, it was being reintroduced by this administration. We had Crunch Month that took place over the summer of 2024, which was an absolute success, with residents seeing the contribution of the crunch coming back, being able to dispose of household waste at a time and in localities that were convenient to them, without trying to rush to get an appointment for the dump service. That is a very incredibly valuable service, but if you're working Monday to Friday, it's very difficult to be able to access those appointments at weekends. So it gave the crunch gave it the vehicle to be able to come back, and then empowering and making the decision on whether councillors want to be able to provide the crunch service. And I note that not all area committees have invested in all 6 crunches that have run out across this year. Councillors have been able to make these decisions that they feel best to be able to support those residents. With regards to the Pride Teams services, never before have councillors of all political parties been able to have a direct relationship with the environmental services team to be able to shape where they see the pride investments going within those wards. So with responsibility comes accountability. The responsibility of the area committees to be able to take that on, to be able to shape those services that I think I speak for all councillors. One of the top 3 inquiries we will receive is about pride team services or investments in our environmental areas within our wards. So with the opportunity to be able to shape those services comes with the responsibility then with the increased budgets that we provided this year compared to previously. But what I think is really important to be able to know is that prior to any funding decisions about the shaping of this current services going forward, both the Cabinet Member for Environment and Leisure and myself met with each of the area committee chairs individually and their vice chairs to be able to talk about the proposed changes and be able to answer any questions that they had. And it received absolute enthusiasm across all 6 area committee chairs. At no point did any area committee say to me, I don't think that's something that we should be funding. I'm not going to recommend that for our area committee to be able to decide. The enthusiasm was very, very strong across all 6 area committee chairs that took place. And I would particularly want to thank all those area committee chairs for the constructive way that they engaged within those discussions. Councillor Schrader references the parking services, and we made decisions at the time. I referenced to difficult funding decisions with the funding gap that this administration inherited when we came in 2 years ago. I think what Councillor Schrader is missing the opportunity to be able to do is talk about the huge soft power that the area committee chairs have in being able to levy and being able to ask for contributions from other organisations, businesses, community groups, business improvement districts, town councils and so on, that the Wickford Area Committee, and I pass my thanks on particularly to them, for the constructive way they acknowledged that we needed to tackle some of the parking problems that were in a particular area in Wickford of people being able to park for all day or park all day for free. Actually, the parking charges were able to reduce that. But able to use their ability to be able to leverage funding from external sources that was able to contribute towards that. And I think that showed a real opportunity of constructive engagement on all sides to respond to the priorities. And I think there's a model of practice that might want to be observed going forward. And all area committee chairs were involved in those discussions. So I think what this is about, and I reiterate my point, that this is about empowering communities. It's about empowering councillors to make the decisions that they think are the right decisions for their communities, being able to trust them. Never before has a Cabinet Member for Communities devolved of as much power and as much financial resource as I have. And I think it's fundamentally the right thing to do so that we avoid those coffee machine chats of, is there an opportunity to be able to support this group? Not saying that all decisions are made by a coffee machine, by the way, but being able to, if you don't know the processes to be able to go through, you miss out on opportunities to be able to put forward recommendations for groups that you're supporting. But putting through a formal process, a framework, and a measurement score that can then assess whether the funding decisions are the right ones to be able to award.
Thank you. I appreciate that. I just want to say the crunch is much better for people like me to go there and get some help getting it on the wagon. If I go down to Barleylands or Pitsea, they just sit and watch me, and it's very difficult. So.
Thank you, Chairman. I did raise a question yesterday on the funding with the officers. I raised it initially when the funding was given over to the area committees, and the officer today provided me with the table to which goes to area committees. All committees get £10,000 per ward. That's for one fund. So Billericay and Wickford will get additional because they've got 3 wards within their area committees, whereas the other 4 committees have got 2 wards. You've got 2 wards, we've got 3 wards. So we get 3 lots of 10, you get 2 lots of 10. Now, when it comes to the Believe in Basildon Fund, whether it's the capital or the area money, each area committee gets £30,000 per committee. But it doesn't give Billericay and Wickford any additional funding because they've got an additional ward, meaning there's additional people. Now, this once went to scrutiny, and it was just rolled over that, no, this is what we've done. Yes, it went in a cabinet report, but I'm bringing it up this evening because for what the cabinet members spoken to about this is working and that's working, we've got to be fair and equitable. And I've been told, and I think it was in a report, that this was equitable. Well, if someone can tell me how it is equitable, maybe I will understand. But when you've got X amount of wards, two area committees with more wards than the others, but all receiving the same money, not the ward money, but the capital and the area money, there has to be some adjustment to put that and correct that, because we have an extra ward to fund out of that money, whereas you've got 2 wards and we've got 3. So can somebody understand me and say that there is something wrong with the system? Because there is. It really is unfair. So that is my major question, Chairman, that I would like to get a response from. Not someone to tell me, oh, well, yes, it's fair, because I even brought to the Scrutiny Committee the amount of constituents in each ward. So say, for example, on average, there was 9,000. It went between 8,000 to 10,000. So on average, each ward has 9,000 constituents. So that means that Billericay and Wickford would have 27,000, so there's all them extra residents, whereas the other 4 area committees have got, it would be 18,000, but we're all getting the same funding. Nobody has, so how it's worked out that it's equitable, I don't see that. Do you see that, Andrew? So maybe someone can put that right. Do you see that, Chairman? You know, do you understand what I'm saying? Do you, Andrew? You know, do you understand that? Because that's been funding for 2 years, how that has been
Let's ask Jack to see if he can put some light on it.
Thank you, Chairman. Thank you, Councillor Sargent, for raising your question. I think the first thing to be able to say is that the area committees that have bigger wards have bigger pots of funding that are able for them to be able to access. As Councillor Sargent quite rightly raises, that if you get that the area committees get £10,000 per ward, so those area committees that have 3 wards get £10,000 more than the area committees that have 2. I do understand the.
Each ward gets 10,000.
So if we look at the overall envelope that each of the area committees have, then from the 2 pots of funding, the area committees that have more wards have a bigger envelope to be able to access, recognising that they cover bigger geographic areas. What I also think is an important point to be able to make is that some of the areas across the borough have bigger funding resources through parish and town councils that are there in place that may support some of the priorities that are being put forward by the area committees. I remember when this went to scrutiny in September 2024, there was a number of ideas put forward on what the funding split was going to be. I think within the opposition groups that were on the scrutiny committee meeting at the time, they recognised that actually each different funding model that you had different pluses and minuses that went with it. So actually, at some point, you have to make a decision. We've tried to make the fairest decision that we've possibly got, which is recognising that the area committees that cover that have more wards have an extra £10,000, recognising that each area committee has £10,000 per ward. What I also think, and I'd like to point out on in the agenda pack tonight, is the area committee's available budget for next year going forward, and I take into consideration that it does include the carry forwards, but the area committee budget that has the highest is Billericay with 122,800, closely followed by Wickford at 114,100, followed by Pitsea followed by Langdon Lily Chapel at 113,100, followed by Pitsea at 111,000, followed by Wesley Heights at 109,300, followed by the Basildon Area Committee at 90,400. So I think those points considered demonstrate that we've come up with the fairest possible way to be able to put forward funds that are available, recognising that some way we have to make a decision. And actually, councillors have the ability to be able to invest in their wards now, when 2 years ago they didn't. So actually, I think there needs to be a recognition that we've put in place a mechanism for councillors of all parties, of all areas across the borough, to be able to invest in their wards and invest in the priorities that they see are the most appropriate ones for them.
As I said, Chairman, the additional money we get isn't additional, it's just for having, because what we could actually do is those two extra wards, those two extra walls, one in Billericay, one in Basildon, we could set up another area committee. So there'd be 7. And they'd all be exactly the same then, wouldn't they? So then they'd get the same, all the same money. So you're just making excuses for what isn't fact. We do not get extra money. We get the same amount because we've got 3 walls, the others have got 2. And for the capital money and the area money, we get 10,000, or we get far less. However you work it out, but it doesn't matter. I just want to make this is a review of the service. And this is a scrutiny committee, and as one of the scrutiny committee members, I'm putting forward what is fact. Financial fact, it's there. You obviously have made up your mind, like the other committees did, that we're getting more money. It's not the way that I feel, or the way that I see it, or the way that the figures add up. So that's it on that one, Chairman. If I can just ask about or just go on about the crunch. I don't know whether you're aware, but in some areas, Chairman, we can't have the crunch because of the amount of vehicles. I mean, I know it happens in, does happen in a number, and we at Notebridge have never had a crunch. And well, you do. And then at previous committees, we have asked the officers, you know, the parks officers, if they would go away and try to do it. So even if we had one, not recyclable, just or something, one vehicle that we could have, or even if it took turns and you took one away, you know, even if something could be decided where we could have a crunch, because they've been at Ramsden a couple of times at the Crays Hill, which is great. And the chairman said we have cars. Yes, we do, but sometimes, you know, our residents don't have cars, and it's great for them to borrow. You know, to borrow that, you know, so that's on the crunch.
Terry, do you want me to answer that? Sorry.
Can I just go through it, Chairman, and then you can kind of pick up, if you don't mind, on the other things. The car parks as well, I really don't think that was fair. I really don't think it was fair to have the area committees pay for that, nor the pride teams. I know, and I've got to say, I've got all respect for the pride teams. They have done some fantastic work.
Yeah, they've been fabulous.
They have, in all of the walls that they go to, no one is different. They've gone to every ward and they have made our areas look good. So, I mean, I have got all pride for the Pride team, but it's just that the funding of, what is it, 38,000 out of our budgets, I think is quite substantial. One other thing, but I'm still in favour of it because I like the work they do and they keep our areas looking nice. What concerns me, and maybe the Cabinet member can look into this, is the cost of installations. At our last informal meeting, or no, I think it might have been the actual area committee meeting, we agreed with, it was a hoop or something that was going in a park. Now, you can't odds that. Kids love basketball or whatever they do, so we said yes. The cost is, or was, I don't think it's been done yet, £13,817. So I think the officer's here tonight, and I questioned why it was so expensive. I said it must have been a blooming darn fancy hoop.
Solid gold.
Absolutely solid gold. But the officer said the hoop came to about 1,500. It was the installation. Now, how can an installation, I mean, yes, it was probably on concrete.
Yeah, but it depends who's installed it.
But this is why I've raised it, not just because of, well, because of that, but there must be other installations in all those area committees all over. And that's absolute extortionate. And I think I said so at the area committee. We really do need to look into that, because we could get 2 hoops put in for the price of 1. Surely, you know, we really do. You know, we're looking at a value for money and for the benefit of the residents, but that isn't a good value for money. And I'm sure the youngsters would like 2 hoops rather than 1 at that particular cost. So, yeah, I mean, apart from that, I was a little bit peeved, which I'm sure has come back to some officers. We have a sheltered housing group that's very, very active, and it's very proactive at Notebridge. And their tea urn was being taken away and gone around centres because they were short of tea urns. And they told me. So I said, oh, I'll get one off the area committee. So I put it through to the officer, don't worry, and then she came back, what size do they want? She's obviously gone back to the social sheltered housing team, and they've said, oh no, one's on order, we've got one. So that was at the beginning of January. I've got the dates. So that was beginning of January. Well, it was only a couple of weeks ago. I went into the sheltered housing scheme because they had their coffee morning. They hadn't got their urn. They had one which said craft class on it, was on loan. So I said, what the heck is that doing? Because let's face it, 2 months later, it should have been there, but it wasn't. And so I went back to the chairman and I went back to the officer and said, can we please let them have a tea urn, even though, because in January, or was it February, that was our last area committee. But I thought, being as I put it forward, maybe we could buy one. And I was told, you know, no, it is on order. But I just don't understand that they were having their one going around schemes, which I don't think is good practice, you know, not for an electrical item that goes around, not a tea urn in any case. And then you're told it's on order. 2 months later, it's still not there. And then all of a sudden, lo and behold, the very next day, a new one appears. So we don't need the money anyway. But the thing is, so there we go. I'm saying to the sheltered scheme, oh, don't worry, I can get you one off of the area committee. And the officer has said, yes, we can fund that. and yet no, you couldn't fund it. And I just think I would hate that, not because it was me, or it could have been anybody that had wanted some kind of item. Was there any feedback to say, you know, to ask that shelter scheme, did you get your earn? Because it's not for me to go and say, oh, did it get done? I just hope to see it on a list. But it did not happen. And I don't think that is, you know, I don't think that's the way it should go, because at the end of it all, that's how it was. It wasn't right.
Thank you, Chair. Thank you, Councillor Sargent, for raising a number of issues there, and I hope I'm going to be able to remember all of them. If I don't, please feel free to challenge me, and I will make sure I cover each of them in turn tonight. I thought I was going to get blamed for hoops and urns this evening, so but I take it with the spirit that you've raised it. No, thank you for raising it. I completely accept the point you're making. I don't think that's something that's necessarily within kind of the operations of the area committee per se, although I do understand the link that's being made. I think that's a kind of around a procurement operational issue that we can take away separately, and I'll happily take that kind of away. I think it's a fair point to be able to raise that when there's installation taking place across different parts of the borough, can we join forces between different installations together depending on what's going on. That is dependent on the providers that are installing equipment on our behalf. Naturally, one hoop is going to have higher costs than on economies of scale of two, but I think what's important actually, and using the area committee chairs forums to be able to look at what opportunities and what activities are coming down the horizon, what's also just been funded, to then be able to join forces between installers if that's appropriate, then we can try and get the cost down as much as possible. I think that's absolutely a fair point to be able to raise, and I'll certainly take that one back. With regards to the crunch specifically and the site, I am aware of the issue that you've raised, and I will take that back with officers and arrange a meeting to be able to talk about that with your area committee chair and yourself, if that's okay, to be able to address those specific operational issues that are going forward. As I say, the mechanism through the area committees is the right one. Decisions have been made quite rightly at the area committee level, but then it's about how we can take that back and kind of input office efficiency as best we can after that decision. I'll involve you fully within those discussions. Have I covered the points that you raised? Thank you, Chair. Just in advance of full council tomorrow night, I'd like to just reiterate my earlier comments this evening, just to be able to thank all of our council officers that have been involved in the area committees. Lots of hard work goes into due diligence, preparing reports, making the meetings operationally work well, engagement with our voluntary community sector. I'd also like to reiterate my thanks to all area committee members for their involvement within the area committees. As I said right at the start, the concept of the area committees, and Councillor Strada was quite right to raise that it was the concept of the late David Harrison. I'd particularly like to pass my thanks on to him for introducing the idea. The principle behind it was around being able to make sure that decisions were being able to take place at the most local level, being able to spread the ability for councillors to be able to make decisions and make sure that all 42 councillors have an opportunity to be able to represent the residents that they were here to serve on the issues that are most important to them, and be able to have pots of funding that are available to be able to invest in their communities, to be able to use that to leverage funding from external organisations and grants, and be able to listen to the priorities of the community to be able to go forward with. And I think that has been particularly successful. I'm looking forward to seeing the area committees go from strength to strength in future years, because I believe it's a concept that works, and I think that everybody is engaged constructively within the process. So overall, I'd like to pass my thanks on to everybody that has been involved in that, and thank you for your support.
Sorry, the work programme, last item. There's already 6 items on it. I don't think we can add to that. There's plenty of work in there.
That's all over 4 quarters, Chairman.
Yeah, but we don't know who's going to be in control of the council and whether we're going to be sitting here again.
No, I'm just responding to what you said.
Yeah, so...
We can't answer it, and I said it is over for you.
Yeah, no, I realise that. So I think I think that's all we can do at the moment, and look at it again after the election. Okay.
Sorry, Chair, could I just ask one question? Because I know we had the discussion about the notes, and we can try to reflect more of the discussion in future, but we didn't establish whether the minutes of the last meeting were agreed or not, I don't think.
Oh. We didn't have a vote, did we?
No, that's what I'm saying.
Is everybody happy with the minutes of the last meeting?
Thank you.
Well done, Terry.